Okay. So, very good evening, everyone, and I would like to welcome all of you to this last session of this webinar series that is on virtual learning in nursing education. So, for the last 3 days, we have had wonderful speakers. We have had a lot of discussions. We have had rigorous sessions on different topics, right from escaping the uh, traditional classroom and using gaming ideas, and then we have had a discussion on the theoretical as well as the clinical dimensions in virtual learning. Yesterday we discussed on virtual learning during the COVID-19 pandemic, and today we will be discussing on telesimulation. So on behalf of Amity College of Nursing, Amity University, Haryana, I would like to specially welcome our speaker for today, Mrs. Muthulakshmi Aramagam. And ma'am is a nursing faculty in Harmony Healthcare Institute, US. Before that, ma'am was in India and she was a faculty in RAK College of Nursing till 2004. Then she moved to US, and there she worked as an in acute care in Emerson Hospital, and she has been a nursing educator. She has been assistant director of nursing and director of nursing in Genesis as well as Conrad Healthcare Center. And she has completed her MSN in nursing education from University of Phoenix, and also she has been awarded the Boston Globe 2009 nominee for demonstrating exemplary clinical proficiency and patient compassion. So it's a pleasure to have such an eminent speaker among us, and we welcome you, ma'am. And it is indeed an honor and a privilege to have among us Dr. Padmadevi Banerjee, Pro Vice Chancellor and Dean Academics, Amity University, Haryana. And ma'am is a doctorate from the University of Delhi and fellow of the prestigious Somatic Index Series, FSIS US. And ma'am also heads the Center for Break Studies, Center of Excellence at Amity. Ma'am is known to be a sculptor of human character, and she has always been an epitome of knowledge, excellence, and great leadership. It's a pleasure to have you, ma'am, and thank you so much for gracing the session with your presence. We welcome you, ma'am. And I would also like to welcome our beloved principal, Professor Dr. A. Tamil Selvi, my co-organizers, Mr. Surendra Sharma and Simpi Raheja, my faculties, all the participants joining us and those who are yet to join us, and my dear students. So I welcome all of you to this last session for today. And before we dive into the session, I would like to request our respected principal ma'am, Professor Dr. A. Tamil Selvi, to for the opening remarks. Please, ma'am.
Thank you, Eva. It's an good evening to everyone here. So it is a very proud moment to organize this international webinar series from the day 9, July 29th on different topics. Why we had this topic, we have selected this topic is we know in COVID, due to COVID-19, we all shut down at homes. And when we are thinking how we have to carry out with our routine work, so when we think of the virtual learning is the way where we can deliver our curriculum to our students. So this will be an hot topic during this pandemic time, and this will open a new paradigm. So the topic was chosen for this webinar series was virtual learning in nursing education, an emerging paradigm. So we had an eminent speaker from USA, Bahrain, and in India, and the topic the first day on 29th we had an escape traditional classroom, applying the escape room gaming ideas to nursing clinical education. So when you read the topic itself, it isn't very attractive. We know nowadays the students want to escape the classrooms. So they don't want to sit or the PowerPoint, so we can read from the PowerPoint. And sometimes they get bored even by using the PowerPoint. So because the millennials, they want to participate in learning. So they want active participatory learning method, and the Miss Shiny, professional development specialist, Baylor Scott White Medical Center, Garland, and she was delivering the talk on this escape room gaming ideas to the nursing clinical education, how we can use this gaming technique. So nowadays, the children are very much interested in solving puzzles, playing games. So introducing these themes in the education. So by doing this gaming, the students learn things, that is learn the concepts what we need to teach. So the topic was well explained, and it was appreciated by all the participants. The second day, we had a virtual learning, theoretical and clinical dimensions of nursing education. So this was dealt by Ms. Nirmala Ji. She is a faculty, College of Health and Health Science and Sports, University of Bahrain. And she explained about, so what are all the virtual techniques and tools are available to teach the nursing students. The few examples are like LC for clinical skills, Septris Stanford, and Google vSim technology. So these are all the freely available technology and tools can be used to teach our nursing students in this pandemic situation. So the learning can take place. Then yesterday we had an virtual nursing education in India during this COVID-19. So when the speakers were explaining about how in abroad they are practicing and what all the free tools are available, what is happening in India. Even from Amity University, Haryana, and Amity University, the whole university in all areas, the virtual learning started taking place when the day the lockdown happens. So we all are trying to use this MS Team, and the students also informed well ahead of time, and the teaching was continued in the MS Team. And also there are free tools are available like Google Meet, Zoom, all these apps can be used to teach the students. And also she explained about how to conduct the clinical examination, like having an ASCII and OSPE, that is objective structured clinical examination and objective structured practical examination. Using these methods, we can assess the students objectively and give evaluation. So all these things we had for the past 3 days, and today we are going to have a talk on telehealth simulation in nursing education. So this is delivered by Ms. Muthulakshmi Arumugam, nursing faculty from USA. She is an eminent speaker. Basically, she is an Indian and she settled in US, and she is a very eminent speaker and talented. So I welcome you, Muthulakshmi, for this great session.
Thank you, ma'am.
And also I welcome our Provisi ma'am. Ma'am is an excellent and efficient leader and backbone of all our activities, I could say. So ma'am will at the back, and ma'am will give all support to conduct any of these programs whenever we approach. And ma'am is Dean Academic and support in all our academic activities and keen in students learning. She is very much keen in students learning and faculty welfare and all these things. And thank you very much, ma'am, for your all support throughout this webinar series as well as for other academic program. Thank you, ma'am. I hand over the session.
Ma'am, thank you so much, ma'am, for briefing us and for giving the opening remarks. I would like to invite Dr. Padmasree Banerjee, Honorable Pro-Vice Chancellor and Dean Academics, Amity University, Haryana, to kindly share with us a few words before we start the session. Please, ma'am.
Thank you, Dr. Eva, and thank you, Dr. Sylvie. That was great presentation from Dr. Tamil Sylvie. And I'm feeling so energized to see my own team here. And I can see so many more at the virtual team outside. I mean, people who are so committed to, you know, the learning or exploration or connecting to each other. I think it is brilliant. I think if we didn't have this pandemic situation, we may not have realized the power of the virtual, interface. There has been this technological disruption from, I think, last 15 years. But I think there was always this inhibition. Now we have seen that how seamlessly, at least in the higher learning institutions, move to an online teaching training. Now, the biggest challenge, which I think the medical community and the fraternity in medical education and nursing education, wherever there are clinical practices, is the biggest challenge, that how do you make learning meaningful and have great impact and output, use simulation, use the hybrid system, use blended learning, and still have the same kind of impact. So welcome to each one of you to Amity University, Haryana in Gurugram. We are a very lovely campus. I wish I could take you on a virtual tour. You can always visit our website. It is a 110-acre green campus and very close to the Aravali Hills. And it is one of the India's the very first platinum LEED certified green campus. So we are committed to sustainability in all ways. And so far as, like Dr. Tamil already mentioned, so far as our academic excellence is concerned, we are committed. And apart from being in India, which is the first eye, we have three more eyes. One is innovation in teaching, learning, academic delivery, and the kind of robust curriculum. The second eye is that of industry integration in terms of hospitals, research institutions coming together with the university through projects, through life immersion projects and research. And the third eye is that of internationalization, which is a global connect. So I'm so pleased to have with us Dr. Mathu Lakshmi, and she so kindly agreed early in the morning because to come and grace, and I'm really eagerly going to listen to her, address after this. I have a few messages. My first message is that as educators and as people from the other side, because you're caregivers, you are going to create history, because we have, none of us sitting here have witnessed this pandemic. You are going to deal with today the young adults who are learners in crisis. How are you going to teach them? How are you going to make this journey meaningful? So what are the kind of best practices that will come out? So I think our university will come together with all of the deliberations that has taken place into the form of a white paper, which we will share with all the participants. And I must tell you, our Honorable Chancellor, who is very committed to innovation, we are looking at a journey where we want to have a great innovation in everything that we do, whether in terms of the hands-on experience that a student get. Our clinical practices are robust. In Amity University, Gurgaon, like when the students are going out to the hospitals, they're looking at the real cases. They're getting into the community. So lots that can be learned. And today's topic is also very interesting. We will see that how are we going to have, telehealth, which is catching up in a big way. I cannot imagine earlier doctors consulting was taking online. Nowadays, online, you can share the test results. You can show your ultrasound reports. You can meet face-to-face through a video call. And, you are getting proper, even emotional connect, not just the physical connect, the emotional connect. And one small exercise of that is the power of our mind is, before I end, I want you to do a very small exercise, at least for the participant. The panel can just sit and enjoy that fit. It'll take you only 30 seconds. I want all the participants who are participating, a large number, hundreds of people who have registered with us. I want all of you, for a blink, for 30 seconds, I want you to close your eyes, listen to my words, close your eyes, take a deep breath. Wherever you're sitting, sit comfortably. Close your eyes, wherever you're sitting, sit comfortably. Now you imagine mostly all of you are at home, or maybe at a very comfortable part in your house or working space where you are created into a temporary office space. From there, imagine you have got up and you're walking towards your refrigerator close to the kitchen or inside the kitchen. You open the refrigerator. There is a lemon lying there. Pick it up. Take a knife from the drawer. Cut the lemon. Take a spoon. Drop 2 drops of lemon on the spoon. Okay? You've tasted the lemon. Now slowly you come back and sit on the chair. You have gone, you have cut the lemon, you have come back to the chair. And I can tell you, each one of you, you must be having a little bit of taste of lemon or the smell of the lemon or the saliva, right? So that is the power of, how you are able to communicate even virtually. So why not telecounseling and nursing education? You can even touch the emotions on your, the abilities that we have as individuals. So I think through this small thing, you can all now relax, enjoy this lovely session. And I will be looking forward for many more sessions, and all of you are, invited on better times post-pandemic. I think Dr. Tamil Sylvie and her able team, they are going to invite you to the nursing college for a grand, session with, teaching, learning, sharing of best practices. Many of you may be actually practitioners. Many of you are already educators. So with these words, I wish each one of you all the very best, and let's make this 2020 not a blank year, but a more meaningful journey ahead. So thank you very much to each one of you. Thank you.
Thank you so much, ma'am.
Thank you, ma'am.
Inspirational and for motivating us, and for the lovely, I would say, message. A good start for all the participants and for us. And now without further ado, let's dive into the session. And I would like to invite Mrs. Muthulakshmi Arumugam to speak on telesimulation. Please, ma'am.
Hey. Thank you so much for that lovely introductions. Can I start now?
Yeah, please.
Okay, so thank you, ma'am. And I'm just going to share my PowerPoint first, and then we are. So little bit about me. I work in a School of Nursing right now. So I do teach LPN students right now. So of course, I graduated from PSG College of Nursing, and I did my master's in nursing education from US in University of Phoenix. It's been a long year. It's been almost 21 years practicing and teaching. So we all, basically, let me go back. I worked at RIK College of Nursing for 5 years. So then came to US. The telehealth was used since the time I arrived, but it was not being that much populated and spoken for. And it is, I think, one another way, the COVID has brought a very different aspect, as ma'am said. Yes, it is actually in a positive way. It opened up a lot of avenues, a lot of new inventions to see how we can do different aspects of work to go through the stage. Yes, practically speaking, is it a great situation? No, yes or no. But you know what? America has been hard hit, and we are in the pandemic. It is very hard to see that, but still, nursing program did not stop, and we are working on, we are doing good. So nurses are doing great, and they are doing the best what they could do. So telehealth has been used extensively to keep the population safe and in various aspects, and our nursing program to run also. So today, I'm just going to give you a little bit of things, what telehealth means, and then how I practice right now, and future, how is it going to be. The first thing we are going to see is how the telehealth is going to be applied in a focused assessment. The focused assessment is very important in being a nurse. I would say that that's very, very, very important when you communicate with a physician. So formulate a plan of care. Here, I would stress enough that we need to have good understanding of nursing care plan. And then the educations, we can use this media for educating a patient and caregiver also. So these are all used to now, and we are doing it. What is basically telehealth is? Telehealth is basically providing medical and nursing care via video or audio to patients who are suffering from chronic illnesses and rural community where they have limited access to healthcare facilities. Yes, we do now see patients on telehealth, and then we do that, but it is mainly used for chronic illnesses and rural community where it has a limited access to healthcare facilities. And then how are we going to apply this one in our program, in our nursing curriculum? Let's see that. And this is just a simple case study. I did read it, which was actually made more sense to me. Then I said, oh, you know what? Why don't I share this with you guys? The first thing, this is about a 9-year-old African-American female. And she was in the school and she developed a red eye and itchy throat. So always the school health nurse is there. So she assisted, and this student, she takes only Miralax for constipation. So now we have to communicate. So there is, again, the consent is a big thing. So we have to have a signed consent before we communicate a provider. So we have in America, anyone has to be treated, younger ones, they need to have a parent consent. So then already they have given the consent that any non-urgent situations, they are allowed to contact a remote healthcare provider. So then there was a school counselor who is facilitating this process, and the school health nurse, and she is checking the vital signs and collecting all the history about the red eye, how it happens and what's going on, itchy throat, and including vital signs she collected. And the school counselor is supporting her for getting more information or any help she needed. So once we have all the information, the nurse is going to call the physician. And then when she calls the physician, the family member also there, she has been notified. So she is able to attend this telehealth from her work. So that has been communicated, and then the patient has been treated. In a nutshell, here, the child, she was in the school, she didn't take a leave to go and visit a physician. And then the nurse who was collecting the history, she didn't go anywhere, she was there itself. And then the mother, who was supposed to come from work to pick up the kid to go to the doctor, she doesn't have to do that because she was able to be at work. And again, travel, commute, so that it was cost effective. But this is a scenario, but this has been applied to a student. So this was a nursing student who acted as a clinical presenter. So the school counselor was a faculty who she was actually there in the school and acted as a school counselor. The patient was a patient, and the student was a clinical presenter who collected the focused assessment, collected all the history, and contacted. But here, it's my view, what I brought is, okay, how can we apply in our school setting so that we can practice in such a way that school counselor could be a faculty and patients could be a second year student, final year student, who knows all the signs and symptoms and who can pretend as a patient. And we can have another student who can be a second year or a fourth year student as a clinical presenter who can collect all the assessments, including vital signs. And reporting could be another faculty or another master prepared student who could be a remote provider. So this way we can play the telehealth role in our school, which I am doing it, and we have seen a great success. So how to perform a focused assessment, right? This will be a biggest event to know about it. We have always seen a patient in front of us, and then we have evaluated them. How am I going to do this focus assessment by not seeing a patient? Is it hard? It's not really that hard. And I didn't know that. I have used this focused assessment when I came to this country without knowingly that is a telehealth. So I can give you an example. There was a patient who was admitted with a high blood pressure, extremely high, and he received all antihypertensive medications in the emergency department. And he was coming to me being told, oh, you know what, this patient was going to be admitted for only a couple of hours. After that, you can just discharge him. So I said, oh, well, that's fine. And I received the patient's did admission, and the blood pressure was almost 170 over 100. I was saying that how come that could be possible? The patient received all this antihypertensive, but still did not come down. Okay, so they said, give amlodipine 5 milligram PO, and then we'll wait. My critical thinking, my clinical assessment honestly helped a lot here. Nobody said that you should recheck the blood pressure or do anything. It's a nursing focus. I did it. After 45 minutes, I was not satisfied. I said, no, I'm not going to send this patient home. So it's a teamwork. But when it comes to the point of, again, physician's advice and other you have a clinical leader, you have a supervisor, and then we have to admit a patient based on this patient's discharge. So many things involved in it. So we were thinking, what should we do now? So everybody said, no, you cannot do anything. You have to discharge the patient. I stood up. I said, no, I am not going to discharge this patient. I will wait. And that was the time, because it was a Friday evening, there was no staff. I mean, it's like we have nurse practitioners who was seeing this patient, but she left for the week. She said, it's a weekend off, so I'm just going off. So now we have a provider I don't know who it is. The doctor is from from Boston Medical Center or somewhere. I'm calling him and saying that, hello, so this is so-and-so, and I'm not comfortable sending him home, but you want me to send the nurse practitioner gave me an order to discharge him. What do you want me to do? So he said, oh, you know what? Already there was an order. So this takes 24 hours to 48 hours. So discharge him. It was really a challenging moment. What I did, I took a step. I spoke to the family. I said, you know what? You guys just go home. If you want to take him home, I can discharge him. I don't have any problem. But you just write it at the bottom saying that nurse was completely denial in discharging my husband. But it's me and the other doctors and everybody in agreement to take the patient home. But luckily the wife was not willing to sign. The patient stayed. The best part, even today, I feel proud of myself as I did the right thing, which was really great. The middle of the night, the patient had a massive EMI. He has been airlifted to Mass General Hospital, which is one of the best institutions we have in Boston. And he had a stent put on and he survived. If he would have gone home, he would have been dead in the bed. So the thing is, my assessment helped. At the same time, the person who was on the other line, no idea how the patient looked, what it is going on. So that being said, focus assessment is very, very important. And again, coming to US, it's always, you have to be assertive, And you need to be advocative for a patient, so that you need a sound knowledge and sound assessment skills. So this is just an example. I'm going to say that, okay, so I have to see that how do I derive that this patient might be having a tuberculosis. So let's see here. You can ask the patients, are you having excessive sweat at night? Are you feeling very tired in the evening? Are you feeling very hot if they don't have a thermometer? Do you feel like you lost so much weight? Okay, can we suspect of tuberculosis? Yes, of course we can. Congestive heart failure. Okay, how do we assess the lung sounds? I'm sitting here and I don't know how the patient looks like. Okay, here you can go. You can ask the patients to ambulate. Can you please walk on the stairs and see how do you feel? Or can you walk on the platform and see how do you feel? The patient is saying that, oh, I'm having a breathing difficulties. I'm short of breath. That tells you that, oh boy, the patient must be having a fluid built in the system. And we can ask, okay, do you have the ring which is getting very tight on your fingers? And do you have the clothing which is getting more tighter and tighter day by day? Of course, that means the patient is having some issues going on with a heart failure. Next, these are like a brief information I'm giving you. There are books available exclusively to talk about how you can do the focus assessment in a nursing school. Those are excellent. And a wound assessment. I can see the wound, and we do have a lot of privilege now. As ma'am said earlier, that you can see x-ray online. And if you have a wound, you can take a picture and then you can send it, because we do a telehealth. So there you can share your picture. The doctors can visualize it, or anybody can visualize it and can say that, oh, this is the wound. It is actually granulation tissues there. Or no, this is not, and this is getting worse. We have to bring the patients in so we can decide on that. And again, educations. Honestly, this is a great piece. You can talk about a hypertension and diabetes mellitus, which are very common in India, a diarrhea, lice infestation, oral and dental hygiene. So we can talk to the community through online. You don't have to be there. You can create a website, you can create audio or video, and or otherwise audio, video, both, and can be shared to the public. As a student, we can do a lot of things. And this is a very good thing. And of course, we are like telehealth as practitioners are doing this right now. But our focus is, yes, we have to bring the telehealth into nursing. And there are researchers mentioning about telehealth should be a subject in near future. So, and again, we are good in cultural performance. When I used to work and take my students to TB Meherly Hospital for a posting, we did awesome work there. At the end of our session, we used to have a cultural program. It's all about how we categorize the dots and what are the signs and symptoms you see. And believe it or not, it was always a very, very, very successful event at the end for us. Many patients will be sitting outside and they listen carefully. So in that note, I would say that, yes, in this pandemic, we can do online videos. The students can perform and they can download it and then like can be shared with the students, or with the patients, or you can do it as a group project at home. So these are my ideas. I thought, okay, how can we improvise? How can we incorporate into nursing curriculum in India? And this is about focus assessment, how we can do it. School health nursing. This is an interesting article, which I read about it. I said, oh, wow, that's interesting. So children with chronic health conditions like asthma, diabetes mellitus, and attention deficit hyperreactive disorder. So these patients have used a telehealth pretty much most of the time whenever they needed it. Otherwise, they have to go for every year visit. They did use a telehealth. Do you know what? It was a great success. Less patients ended up on having hyperglycemia or hypoglycemia, and asthma exacerbation was noted very less. So which was again win-win situation. So that is really a good thing. Again, I mentioned it about earlier, time management, cost effectiveness, and reduced absenteeism in school. Of course, this is a great, I am a fan of telehealth right now after reading, and we are doing it, and then like a lot of it's really helpful. Of course, the beginning of the session, I had a great problem with my computer, my audio, which is there, but still we can rectify the issues. And then about during the telehealth, we included school nurse, patients, family members, and provided. So everybody is there, so we don't have to worry about, oh, I have to talk to the family members after this person, the family was not available. So the provider does not have to think about calling the person after. So everybody is there so that it is a very, very, very time effective work strategy. Then personal experience, it happened last Friday. So last Thursday, I was at work. My husband took the picture and saying that my son had a tick bite. I was petrified. I said, oh boy, what should I do now? So I called this, I was coming back from work after 3:30. I called the doctor. I said, you know what, I want to talk to the physicians. I really wanted to start him on antibiotic. I don't want to waste. And it was really, really a tough situation. So I came home, you know what, how beautiful it was, telehealth. Immediately they called me back. They said, you know what, let's arrange a telehealth visit. So I came 4 o'clock home, 4:30, my son had a telehealth, and 6 o'clock he got the antibiotic in, everything is all set. So it was an eye-opening for me as myself I experienced. So next, this is current practice, what I do in my personal experience. So every day for us also, it's not easy. We think every day that how we can make the students to be very active and keep them motivated, and we don't want to fall back. So we always think various ways. So what I did was I had a telehealth group. First, we started on a Zoom. So we divided into group, and then I gave them opportunity to use concept map, which I will be sharing in the next slide about concept map, and focused assessment we did. It really helps. But what I learned from my personal experience from the studies also, that give them a short time. We don't give them like, okay, I'll give you half an hour or 1 hour, finish up this. Instead, 10 minutes. You are going to select one one nursing diagnosis. Just make one nursing diagnosis for me in 10 minutes. And then another 15 minutes. Okay, give me the nursing interventions, 3 or 4. And we get back and check on them. It really helps, and it really keep them on their feet, and it worked. And role play, this has been very successful with my students. So what we did was we have a lot of case study we created, and we used a lot of textbooks to use or create also. The role play, what I did was I have a student who will be a nurse, one student will be a family member, and one student will be a patient. So they loved it. The whole 8 hours, they said, oh boy, how did the day go? We really enjoyed. Not only that, we learned so much doing our own admission and discharge. We said, oh, that's great. So we did on actually congestive heart failure case study, and we did on sepsis. They loved it. They said, we learned so much about this case now. And then again, in US, nursing and medical students are considered essential people in this COVID situation. So there are some of the schools, they brought the student back in July itself. And there are schools, they never closed it. They have the nursing students coming in where this hospital is attached to this schools. So our students started since July. So we made sure that we have a small group of 9 students. And again, each state have a limitation of students we can have for the clinical. So 8 students is maximum, but we can have 9 students because we were in the school. And we did meticulous preventative measures. And even if we open up the school in in India, it is advisable to do all this. Hand hygiene, we insisted. And then we did tell them to have the mask on all the time. And 8 hours, I have the mask on while I'm teaching. 8 hours, students have the mask on. Is it convenient? It is not, but it is what it is, what follows. It's very great to protect the infections. So prevent the transmission. Then we do have hand sanitizers where students usually wash their hands in and out of the room. After that, cleaning up the area, the areas they used. And yes, we did allow the students to do group work, and it was great too. And students still, they work in the healthcare settings. The students comes to me to the clinical, they are still working as a nursing assistant or something or other, still they are in touch with patients. So that COVID is everybody is afraid of. Yes, it is supposed to be, but if you do your great hand washing, 6 feet distance, and then proper mask wearing, which is actually, it's not going to come to you. You invite, it comes to you as a host, but otherwise, no, it's not going to be there. So the concept map is the one I was talking about. This concept map is a great tool. And as an Indian student, I have used a nursing process, which was good, great. But this concept map, we are putting all the informations in the concept map, absolutely phenomenal to use. My students love that. Every day they say that, oh, the end of the day, I make sure that I do the concept map, what we discussed. It's great. So if you have questions, you can talk to me later today. And then we are working on transcultural care project. This is again the big hit in US. We have to know about different cultures. So transcultural project, that is one of the best thing in India can do. You know, most of the Indian students or Indian nurses are coming to US when there is a crisis, when there is a shortage. So I would say that we need to know about a different culture. When I came to this country, oh boy, it was not easy. A lot of challenges, a lot of cultural issues, a lot of understanding. Just I can give you an example. I never grew up with the plan of saying, excuse me, sorry, thank you, never. And I come here, I have to use, oh, sorry, oh, thank you, excuse me. When I didn't say it, oh, she's rude. Oh boy, I said, no, I am not rude. This is not in my blood. So basically those things needs to be added. So in that note, transcultural might help. So right now I am working on the transcultural projects. So we have divided the group and they are going to work on the transcultural, and that they can make a chart presentations that can be left in the school for future reference too. And next one is skills lab, case study. We do a lot of case study and we just review a lot of skills lab over and over. So, and there are some of the websites, we use them, and those ones are basically about shadow health. And I have some questions coming up and we can answer them later. Is that okay? Yes?
Yes, ma'am. Yes, yes. At the end.
Okay. Okay, so 1 second, sorry. All right, somebody has to help me to take this off. Okay, the next one is shadow health. We uses them. It is, again, it's a very good tool, and we do use the ATI, real-time scenario, which is also good. And there are other ways you can do, like Healthy Simulation. It's a website we can use. And I'm sure my own friends might have said about NLN and NCBN. So all those sites have resources available too. But you can use only a minimum amount of free resources, then you have to buy them. So what are the barriers we have, including or introducing a telehealth in our nursing curriculum? The licensing could be a problem, and we need a lot of evidence-based resources. We need privacy and security and confidentiality. This is mainly a problem for people who are in a healthcare, in the provider side. Of course, the electricity could be a problem in India. And so here, that's not a huge issue. And then, sorry. So another one always came up with the issues changing technology. And as you know, they do a lot of updates and so many things coming up, which could be a little hard thing for nursing professors to do, because they have to modify their plan based on the technology development, which could be a challenging one. And then the cost and government regulations needs to be taken into consideration too. There are times the nurses felt that it must be adding more work to nursing personnel, because telehealth is, again, for this is I'm speaking on behalf of healthcare provider side. The nurses do a lot of work on a nursing side. So they are afraid that, okay, if we see patients, live patients, then we have to do telehealth, which will be a lot of work for us. How the telehealth work right now is, when I have to call, for example, I said about my son visit. So the nurse comes on the line and she calls us and she collects all the history. Okay, when was it happened? How did you identify it? How was the tick? How big it is? How small it is? And how is his temperature? How is he feeling? Is he nauseous, vomiting, or is he having diarrhea, or he's alert, he's active? So n number of questions she collects, and then she just put them all in. And when the provider comes, I spoke to the nurse practitioner, when she comes, she already have all the information. She doesn't have to go over everything. So that it is a lot of work for a nursing personnel. Again, they have to attend the patients who are coming, and then plus they have to see patients also. They have to see telehealth, which is the nursing is, I would say that, being honest, and worked in 2 different countries. I worked in like India, South India, I worked in North India, and then I work here. It's not an easy work, but I would say though, you have a lots and lots of credit when you give a proper care to the patient. So when I did work in US, so it was 2014, I came into US. 2019, I received a Boston Globe nomination saying that how good I was. My care was actually, the patients were so happy about the care I provided and how good my explanation was. Every time there was a letter goes to the CEOs, how good I was, how good things were done for them. This is just an example to say that, like, the work is hard, but you know what? Ultimately, you love it and you enjoy it when you see the patient satisfaction. And then technical support. So we need to have available technical support when you have an issue. So that could be a barrier. And so what about the future considerations here? So we can have a nurse-managed clinical practices. I can think of Chawla now. And when I used to bring my students to Chawla and Najafgarh, I used to go to PhD. Oh, sorry, public health center, primary care center. We used to go for collecting all the meds and everything. So here, nurse managed clinical practice helped, because we used to manage, like faculties and students used to manage, but the provider, she comes only Fridays. So we used to, if we have any questions, we used to contact her, and she used to advise us what to do. Especially we handled with DOTS classification. For the tuberculosis patients, we used to classify them DOT 1 category, 2 category, or 3 categories, so that we used to manage them by our phone. So we already had it, but it was not prevalent. But our students had a great experience there. And then interdisciplinary educations, which is really great because in America, I can speak for America here, we have, at the end of the day, and regarding, we are talking about a patient, so we need to know about how the patient is doing. Are we going to discharge him? So we need to talk to the discharge case manager. And the patient is having a problem with social adjustment, so then we have to talk to the sociologist, a sociology person. And then we need to talk to the patient is going to the community. So we have a visiting nurse visiting a patient once after discharge. We have to talk to the visiting nurse. So it is an interdisciplinary education. So I cannot make everybody to come for a meeting. So here, telehealth is a great thing, and they can sit in where they are and they can discuss the case. And of course, and they are insisting on telehealth in nursing school, so which is actually another one we have to think about in near future, having the telehealth. And that's all about my discussion. So it's open for you. And thank you so much for giving me the opportunity. And thanks again, being patient for this, all the issues I had. And I just wanted to say that because this is my biggest thing. I always say, be kind, help each other, and be thoughtful in this unprecedented time. So thanks again.
Thank you so much, ma'am, for such an enlightening session and for briefing us thoroughly about telesimulation. And now you shall take up some questions, ma'am, for discussion. And shall I read it out for you? Or
yes, please. That'll be awesome. Can I have a little water before I start?
Thank you.
Yes, please.
We can extend only session 5:15.
Okay,
that's fine.
Sure. Like, we'll take up a few questions then.
Oh, few questions.
Okay, ma'am, there is one, the first question. Please tell us if we can do research through telehealth, especially data collection from community people.
So I was reviewing it. Yes, you can do that, but still we need a lot of evidence base to do that. Of course, if the patients are willing and if the community is willing, you should be able to. But here, we can do that here, and we are doing it here. Everything is concerned. So you have to get a consent from the patients and the family and the community. Yes, very well, you can collect the history. Yes, why not?
Ma'am, then the next question. Would like to know more about implementing transcultural care projects. Mm-hmm. Can you share some more examples on transcultural care projects?
Yes. So transcultural project, we did a lot, and like I can give you an example. So I had a patient who was Jewish, and this patient they have a belief that they cannot receive a blood transfusions, even their hemoglobin hematocrit is low. Those are the things we have to respect. Basically, we cannot say that no, we have to give it. So one thing I have to stress here is American and Indian nursing is two different ways. So here we have to go by what patients wants, so that we respected the culture and then we did it. And there are cultures, they say that, oh, I want only a female nurse, I don't want the male nurses. We respected that. A Muslim culture talks about a prayer. They need to have the prayer on certain times. So we cannot, so we adjust the care timings based on them. So these are just an example. Yes, we are seeing it, and so that I teach my students. And African American culture is like, African culture is more or less like Indian culture. So their mentality is different. When it comes to American culture, it is so different. So this, I would say, from my perspective, of South Indians are different, North Indians are different. Their views are different. Similarly, every time the views are different, we have to base the care based on that. So yes, transcultural, we are implementing every day.
So I'll take one more question. That is, ma'am, can you please explain what is shadow health? Shadow health.
Oh, shadow health is basically, it is what it is it's a real robot. So there is actually a person who is there and he talks He tells you, hey, I am Miss Tina Juice. I'm having headache. I am not feeling well. So now the nurse, you have to answer them. Okay. Now you have to see, you have to question them. And then like, actually, okay, what is this saying that? How will it, what are the problems patient is having it? Then you are going to, as a nurse, you will be typing your response so that we evaluate them based on the patient's problems. It's like actually it's a video, but it's like a real patient. He talks.
Okay. Okay. Thank you so much, ma'am. Because the time constraint and time doesn't
I
permit.
know. I'm
There
sorry.
are many questions coming in, but we can, unfortunately, we can't take up all the questions right
So
now.
I would be happy to answer those. So if you can actually send it to me, all the questions, and I will be happy to respond via email. That's okay. I can do it. It's not a problem for me.
Okay, ma'am. Thank you, ma'am.
Definitely.
And I would like to request Mrs. Linda Shamata to kindly
And
propose.
audience, I would like to say extremely sorry today because of me, the things gone wrong. I'm very, very sorry. I apologize. I thought my computer will work, but at the end, I did everything. I went to bed at 12 o'clock because I do my NP program. So I was doing it. And then unfortunately, morning I woke up and I started actually connecting and it didn't work. I apologize. Honestly, I feel so bad for it. I'm so sorry.
No problem.
Okay.
That's okay, ma'am.
It happens. We need to accept and go ahead.
Oh, thank you, ma'am.
Yeah.
I feel sorry. So bad.
So, sir, can you please kindly propose a vote of thanks?
Good evening, everyone. Deem it great honor to propose the vote of thanks to all on behalf of Amity College of Nursing, Amity University, Haryana, who have helped us in making this webinar series such a resounding success. I would like to thanks to our distinguished speaker, Mrs. Muthu Lakshmi Arumugam, for making excellent presentations and making these sessions more interesting and meaningful. Thank you, ma'am. I would like to express our gratitude to our Vice Chancellor, ma'am, Dr. Padmakali Banerjee. She is always inspires for us, and we are really enlightened with your motivational word and presence, ma'am. Thank you, ma'am. I would like to thanks to our principal, Dr. Academicians, ma'am, for her enthusiastic support. My heartful thanks goes to my organized team and IT support team and my dear colleagues and for their constant supports. I extend my thanks to all the participants who are join us and bless us. And I extend my thanks to all the participants who joined today's session. And we are getting very good response from the participant sides. Daily we are getting nearby 800 registrations. So here I would like to thank to all of you for your enthusiastic support for successful of this webinar series. With these warm words, we move to the end of 4 days webinar series. Thank you very much to join with us. I would like to announce one announcement for the participants. A request to fill the feedback form. So that's already we are given in the your invitations
Posters.
also, and
Poster link.
yes, and poster invitations, and now I put in the chat box also. So please fill the feedback. So for by that we can give you and we can provide you the certificate of this 4 days webinar series. Thank you very much.
Thank you so much,
Thank
ma'am.
you. Thank you.
Thank